Good afternoon, Dr. Mudgal. Welcome to the event today. And we will start in a few minutes, and a couple of our members and colleagues are joining. So in a few minutes, we will start. You can kindly remain connected. My screen visible to all of you? That
Yes, sir. Yes, sir. Visible.
is the
Yes,
program
it's
brochure,
visible.
right? It is in full
Yes, it's
screen mode
visible.
or no?
No, sir.
Now?
Yes. Now, okay, sir. Full mode.
Okay. Thank you. Thank you. We'll start in a while.
Hello. Okay.
Yeah, good afternoon, everyone. In the interest of time,
Good afternoon.
I think we will start the meeting. I am sure people will be joining. Some hygiene announcement. Kindly keep your speaker or mic in the mute mode. If you have any query during the course of the presentation, kindly you can put it in the chat bot, or at the end of the deliberation, we will have a open discussion with the speaker of the day, and then we will have an opportunity to hear. So uh, before I start the program formally, that is my request to everyone who is joining. So today we have a very important topic to discuss. This webinar is being given or delivered through the help of ASSP India chapter and L&T M&M SBG. So I will come to the formal introduction of the speaker. You have all seen the brochure. But before that, I have something to do in terms of the background and the celebration of the day. So I will take you through a little bit of history in a way that how ASSP India chapter and when it was established, and then we will go to the technical session. So kindly allow me to go to the next. A presentation we have for that purpose. So I will take you to that presentation. Give me a minute. Is it visible? Is the screen
Yes, sir.
visible? Yeah.
Visible,
Yes,
sir.
it's visible.
Yeah.
No,
Yeah.
Yes, sir.
visible.
Okay. So uh, just wanted to inform you that ASSP basically was established in 1911. That is of course not in India, but it is a 110 plus years organization, and I was introduced to ASSP through one of my ex-L&T colleague, Mr. Nirupam Mukherjee, who had been a long time member, and he has been he has been going to this program for quite some time. So he requested me that we can have some activity in Chennai, that time I being, and our management led by hydrocarbon construction and pipeline, Mr. M.R. Shankar, who is the tall man at the center, was very enthusiastic to support it. And he, in fact, advised me to contact all oil and gas and mega customers and invite them. So we had this launch. Somebody's speaker is on. So may I request to mute it? So with the help of L&T management and my colleagues in Chennai, Varadwaj and others, and Nirupam also came all the way, I think, from Shanghai to Chennai. And all our colleagues, many of our ex-L&T colleagues, and some of our customer, including Michael, as you can see, a smiling face with a French beard backside. And then we have a delegation from US by Rick Pollock and Yasi Dunn. And of course, the team member, including Dr. Ilangavan. You can see the second man from the right. We were together. Varadwaj in behind me, and then there are a couple of other people, including Mr. Jitu Patel and Vijay, Mr. Who is also helping us now retrieving one important gadget, the man in the dark T-shirt. So I am not going for everyone to identify, but then all of them came together, and many of them are not in the dais. So this was in our convention center in Chennai. We had many programs there. The first year anniversary also we had it. That was attended by Mr. M.B. Satish. So this program was launched on 3rd and 4th of March. We had it. Third, there was a conference pre and then fourth conference as well as the launching. So it was a very good moment for all of us. And we started, and some of the office bearers are not very actively associated, but some of them are continuing. So this is what the foundation days, So I'll take you to the next slide. So, so this was the event. You can see Mr. M.R. Shankar, the Executive Vice President and Head of Hydrocarbon Construction and Pipelines that time. Very senior man and very supportive to safety and quality and other corporate governance chapter items. So very nicely decorated it was there. Many companies, as I mentioned, came. So this beginning of this journey of ASSP India chapter. And today I remember many of them. And I think that was a great opportunity to get the support of L&T and meet so many people during the course of last 11, 12 years. So with this, I will now do not stand before you and the learned speaker today. I have a great pleasure in introducing him. You must have already read a bit about him, and that might have attracted you for this event today. There is a formal introduction of my colleague, my friend, and we have also participated together in a 2 years program in Sweden. And actually, we got associated from then. So he's a very kind person. Dr. Mudgal is an international public health expert and also occupational and environmental health and HSE management system assessor with over 35 years of experience with international development organization, industrial apex chamber, commerce, and etc. Governmental as well as HSE consulting, NGO, and diverse industrial organizations, not only in India, but Southeast Asia, Middle East, Africa, and Europe. So currently he is working as consultant of the World Bank for developing environmental safeguards, focusing healthcare waste management and occupational health and safety for health sector projects such as Atmanirbhar Bharat Health Infrastructure Mission and Assam Secondary Healthcare System Reform Project. He is associated and has been with Social and Environmental Panel of experts for the World Bank funded West Africa Power Pool Projects, ECOWAS, West Africa for Hydropower Development in Liberia. He has provided technical support to WHO, Geneva, for developing COVID-19 response guidance, which is a very revered document, I must say, for healthcare and essential services, and incorporated OHS in international health regulations, IHR, training for the countries, worked on India COVID-19 emergency response and health system strengthening projects of Uttarakhand, Meghalaya, and Mizoram in India, and St. Vincent Grenadines Health System Project in Caribbean. He has developed scoping report on health safety and well-being of international migrant workers as WHO consultant in 2019. He has worked as international consultant on OHS with UNDP, Yemen Emergency Crisis Response Project. He is also associated as technical expert with Confederation of Indian Industry, Center of Excellence in Sustainable Development since 2000. And he is also a peer reviewer with Frontiers and BMC Public Health online research and publication platforms. So we are very grateful and pleased to have such a learned and widely experienced internationally Dr. Shubhendu Mudgal among us. We extend our heartfelt thanks and welcome to you, sir. And with this, I will open the presentation and I will request Dr. Mudgal to kindly open his camera for a moment so that we can have a look. And then I think after that, I'll put the presentation. So Dr. Mudgal, yeah, you're welcome. Yeah. Thank you so much. Thank you so much
Sin
for
and everyone.
joining
Good
us.
afternoon, everyone. Sin has said
Good afternoon.
so many words about me, and we share very good rapport for a long time now. I think it's 21 years
Yeah.
for now. And we keep on looking for each other whenever we get a chance. And so this was a chance when he asked 2-3 days back only. And I heartfully agreed to have a clear talk with you on a topic which
I
is
must
very
mention that.
dear
Yes,
to me.
I must mention that it was a very short notice, and it was in fact a demand.
Yeah.
So,
No,
so I think
I've been
he
working on
immediately
it
agreed.
now.
So it was a
Been
very
working on
kind
it
of
now,
you. Yeah.
and this is very close to my heart. There are two in environmental health. This is the area, and in occupational health, basically the health sector, as well as other sectors. I had been working with the corporates, and so we thought that this is a area that we can have a discussion, and so I'm here in front of you. So
Yes, sir. Actually, what happened, you see, this particular area is, we primarily focus on safety, and many of the health and environmental part get generally backseat because safety issues are in the top of the mind of our colleagues, but the environmental health, the occupational health, etc., are not really we are getting the time. But some occasions we must remind ourselves with the help of experts like you, because and then we our focus to some extent has to be shifted. While we keep our eyes and ears open on safety, but we also have to have our heart and mind and soul on health and environmental part. So I think with this, once again, very hearty welcome to you, and I will put the presentation, and we will have, we'll listen, to you very carefully, and then after that we will have some questions and answer if there, um, and then we will take that. So kindly confirm whether the presentation is visible now. Yeah.
yes, it's visible. Yes,
So if
you can
I
make
will
it
do it
full
as per
screen.
your instruction. So what we will do, I will make it. There is some problem in this. Let me. Is it now visible? Is it the full screen now?
No, not visible now to me.
Oh, It has gone out. Okay, 1 minute.
Yeah,
Oh, it has
maybe
gone
again
out.
you can try it again. I
Ah.
think no issue.
Is it visible now?
Now it's visible. Yes.
Is it visible
Yeah,
now?
yeah. Now it's full screen. No, thank you.
Okay.
Yes.
So I will be in the back of the screen so that only your video and presentation is audible. I will also mute myself. If required, I'll unmute. So you can kindly. So the floor is yours, sir. Now I think, and kindly go forward, and we will really be happy to listen to your deliberations. And over to you, sir. Thank you.
Thank you, Sen. So the first page you have already uh, explained it to everyone. So maybe go to the next page. Next slide, sir. Yeah. So when we are talking about the healthcare waste, what it is, what do we know about the healthcare waste? See, when in the health sector, the clinical services are provided, when the patient care is taken care, as well as the various diagnostic services are being undertaken, we aim to help the patient to get well. That is our noble aim, and we most often succeed also in that. But during that process of giving the care, we also generate the wastes of different types. And these wastes themselves can harm the patient. So our very purpose of the patient care can be defeated in that way. So that is why we have to be very careful. And that is why this all uh, area is of area of concern. So when we say what is healthcare waste, any waste that is resulting from the patient's diagnosis, prevention, research, and treatment procedures, as well as waste generated from as a result of other activities carried out in the healthcare establishment, research facilities, and laboratories. All this constitutes the healthcare waste. So that is it's anything that is generated from the healthcare institutions is a healthcare waste. And this can be grouped into three broad categories. One is the biomedical waste. I'll talk about it a little bit later. This is a one type of hazardous waste, but then there are other types of hazardous wastes also, like chemicals, like plastics, like mercury, and like batteries and other electronic waste, etc. So that those are also other type of hazardous wastes. And then there are general waste, which is non-hazardous, which is not considered hazardous to the health and safety of the persons. So these are the three key categories of the waste that are generated in the healthcare sector, and all these together constitute the healthcare waste. Can I have the next slide? But out of these, we will talk today, focus on biomedical waste only, because we have the regulation under the biomedical waste. And as I discuss with you, I will discuss with you, I'll make it clear why we are restricting our talks to the biomedical waste. This is a big area, and that is the area of concern. That is why we have a very specific regulation to manage it in the health sector. So what all is included in the biomedical waste? See, biomedical waste includes the human tissues or body like body parts, placenta, etc., or the body fluids like blood and urine, sweat, uh, uh, sputum, etc., as well as the laboratory wastes like laboratory tissues, swabs, materials generated in the laboratory, equipment that has been in contact with the infected patients and patients' excreta, the samples, etc. These all are also the biomedical waste. Then there are certain cytotoxic drugs which are specifically used in the treatment of the cancer and other diseases. These are highly toxic to the persons who are handling them, those drugs, as well as discarded medicines and the waste from the vaccines. This is also included. And then there is a very important category, which is the sharps. Sharps are very dangerous, and these include the needles, the injection vials, the blades. and they have the potential for causing injury to the person as well as the diseases, as I will see. So all these together are considered as a biomedical waste. Mainly, they have the potential to cause infections among the handlers or their disposal persons. So that is why these are hazardous in nature, and these are covered by the biomedical waste management rules. So may I have the next slide, please? Let us see now what are the areas in the typical healthcare facilities, say a hospital, the district hospital, where this biomedical wastes are generated, as well as other hazardous wastes are generated. See, first of all, the operation theater, where the operations takes place, where the tissues and blood swabs and other dressings are generated, sharps are generated. Then there are surgical wards where the dressings and all infectious uh, wastes are generated. Then medical wards, the syringes, vials, and sharps are generated. Injection rooms themselves, plaster and dressing rooms in the OPD as well as in the theaters also. Then sample collection areas of the laboratories where the samples are collected, and the samples after taking are put into uh, the diagnostic procedures, and the wastes are discarded. So these are the area. Then laboratories themselves, during the process of the tissues as well as the body samples, various types of waste are generated. Drug stores, the waste drugs are generated over there. Dental clinics. Dental clinics are also areas where waste are generated, and especially where the mercury-based composites are used in the dental fittings. These become highly hazardous wastes. Then X-ray department, where radiation wastes are generated. Nuclear medicine, where radioactive isotopes are used, and these are excreted in the urine and other body fluids of the patients as well as. Then radiotherapy also, again, the radiation wastes are generated. And the blood bank, where blood vials as well as the blood bags are generated, the wastes are generated. So all these are the common areas where different types of hazardous wastes are generated in a typical healthcare facility. So, okay, next slide, please. Let us see now what are the different types of waste generated in these areas. We have talked about these areas. See, the operation theater, surgical wards, and obstetric unit. Obstetric units are basically the labor rooms, etc. Mainly generate the anatomical waste like the body tissues, body organs, fetus, as well as body parts, and the other infectious waste, as well as sharps. Then ICUs and care wards, mainly the dressings, bandages, gloves, disposable medical items, used needles, IV sets, body fluids, etc. And food wastes are also generated from the care of the patients. Then laboratories, the highly infectious wastes are generated in the laboratories. For example, the tissue pieces, microbiological cultures, which are very high density of microbes. Then infectious agent stocks, again high density. Infected animal carcasses, blood and other body fluids, sharps and chemical waste. These are generated over there. Then other healthcare units. Other healthcare units, mainly the general waste is generated, like the paper, the wrappings, food waste, etc. These are generated, and a very small amount of infectious waste are generated, like some dressing, some infected swabs, etc. So these are the types of waste which are generated in the different areas of the healthcare facility. Next slide, please. So why we are talking about these type of waste? See, all these wastes, they have a potential for causing health and safety risks. And different types of waste, they have a different types of risks. Like for example, the human, animal, and soil wastes, which are infectious wastes, they have a potential to cause HIV infections, hepatitis C and B infections, intestinal infections like Shigella, Salmonella. Salmonella is a typhoid. Then respiratory infections like tuberculosis, pneumonia, and septicemia even. these can be caused among those who are handling those as well as involved in their disposal. Then the sharps, as I said, have got the highest risk of causing the hepatitis C and B, and also the HIV infections among the persons who are handling those sharps. And if these are not handled in a careful manner, then cytotoxic and radioactive waste, these are generated in the treatment of the cancer patients. They themselves can cause cancers, genetic and birth defects, and infections or inflammation of the skin like dermatitis, and as well as the abortions among those who are handling those. And then there are different types of chemicals, say for example, the disinfectants and various types of spraying, these pesticides, etc., and other chemicals in the laboratory. They can cause acute poisoning as well as skin infections also. So these are I have just given you key health and safety hazards which can occur because of the biomedical waste. These are the common types of infections as well as the diseases which can be caused. So you can see right from the cancer, birth defects, skin, lungs, as well as the serious infections of the intestine, lungs. All these can be caused by the healthcare waste and the biomedical waste. So we have to be very careful about their handling. Next slide, please. Next slides. So as I say, when we say these are the different types of risks, we can classify these risks into the three broad categories. One is the occupational health and safety risks. These are the health and safety risks to the persons who are handling these wastes while these wastes are being generated, transported, as well as then taken for disposal. And these are the basically caused by the infectious waste, sharps, and the cytotoxic drugs. These are the three key categories which can cause these infections to the persons who are working in these facilities. So we have to have a very good occupational health and safety program. Then there are risks to the communities. Community risk, we can say directly the patient, as I said initially, the patient himself or herself can be the victim of the irresponsible handling of the biomedical waste. The patient itself can be affected with the hospital-acquired infections. Then visitors, they are at a high risk. Nearby communities who are near the healthcare facility, like the children, like the old age people who are living in nearby, if they come into contact with the waste, they are at a high risk. So that is also a risk to the community health risk. And then there is a risk to the environment itself. Biomedical waste can cause the air emissions because very commonly it is burned, and burning releases lots of gases, particulates, as well as certain very highly toxic complex chemicals called dioxins and furans. These are complex chemicals consisting of chlorine and other uh, carbon, hydrogen, and oxygen structures and furans. And they have a very high risk potential for causing the cancers in the body. And these are released in the atmosphere in a minute amount, but over a long period of time. And also these are released due to the burning of the wastes in the open. So that is, there is a risk of air emission. Then there is a risk of water pollution due to the chemicals like the various corrosives, the infectious the disinfectants, etc., which are left and these are discarded into the water bodies. They can cause water contamination, as well as the mercury wastes. Mercury wastes are generated whenever, if any, accidentally the mercury blood pressure instrument as well as thermometer is broken and it is not contained in a safe using the safe protocol, and it is left and discarded into the water bodies. So it has a very high potential of causing the water pollution, and ultimately it enters into the food chain and affects the human organism as well as the animals over a long period of time. So that is also a risk through the water pollution, as well as there is a risk of the groundwater contamination also, because if the leachate percolates into the groundwater water bodies, then these can be contaminated for a very long time. And then there is another risk of developing the antibiotic resistance in the microbe, because many of time these drugs, antibiotics, etc., and disinfectants are disposed of in the open water systems, and the microbes, they over a period of time, they adapt themselves to the effects of these anti-infectious agents as well as the antimicrobials, and there is a gradual development of antibiotic resistance in the microbes, and that is becoming a very big problem. And that is why the liquid waste from the healthcare facilities are also now a very important area under the government policy to be tackled. You must know that. Can I have the next slide, please? So we have just seen what are the different types of waste, what are their hazards and risks. So now I think I'm clear that we need that some protocol, some system in the management of the biomedical waste in a health facility. So how it is being done, I'll just enumerate the simple steps when we are managing the biomedical waste in the health facilities. What are the key steps? Whenever as a activity is performed, there is a waste is generated. So first step in it is the segregation of the waste at the source or at nearest to its source of generation. That is the first step. Segregation is very important. It's the first step.
You are not audible, sir. I think it got muted suddenly. Can you unmute?
Sorry, I don't know how it just got. Am I
Yeah,
audible now?
Yeah, now you are audible. Yeah, please.
So any slide which was left out fully or no?
No. The slide is you're able to see the presentation, right?
Okay, right now. If any slide is missed, then I can go back.
No. Just now.
Okay,
Just
now.
5 seconds.
Okay.
Only 5 seconds. Yeah.
Okay. Sorry. So as I say, the segregation of waste is the first step whenever we are managing the biomedical waste in a health facility. That is the first step and the most important step. I'll talk about it later also. And that is a critical step. Once we have segregated, then along with that, there is a pre-treatment of the laboratory and the highly infectious waste. That is also required. As I said, the swabs as well as the blood and urine, as well as the laboratory cultures, etc., which are generated, these have to be disinfected before these are discharged into the external environment like water or as a solid waste, because these are highly infectious. Highly infectious waste have to be disinfected before these are sent further for the final treatment as well as disposal. So that is another step. And then there is next step is the collection and the storage of the segregated waste in the color-coded bins and bags as per the Biomedical Waste Management Rules 2016. Now we have a very specific and very quite simple rules which govern how the waste are to be separated, segregated, collected, transported within the health facility, and finally disposed. Earlier, there was a lot of confusion, but now it is very clear. So there are specific guidelines and the protocols for the collection and storage of segregated waste in different types of color-coded bins and bags as per that rules. And once we have collected those and we store, and then these are transported from the generation site to the temporary storage area. See, temporary storage areas are also required in the healthcare facilities. If you don't have a temporary storage area within the facility, then there is a risk of people getting contaminated, because the waste would be lying very close to the patient area as well as the other diagnostic and other treatment areas. So there has to be a temporary storage keeping facility within the healthcare facility, which has to be separate. And there are certain guidelines from the CPCB which need to be followed for that. And where the waste is stored till it is then transported outside the healthcare facility to the central treatment facility, where these are finally treated and disposed of in a safe manner. So these are the, I would say, 7 steps which need to be fulfilled as part of our total system of a biomedical waste management in any healthcare facility. I will just now go further on this. Can we have a next slide? Yes, see, as I was saying, segregation is critical because it separates the hazardous waste from the non-hazardous waste. And that has to be done right at the source of generation, and it has to be carried out till the final disposal of the hazardous waste. So the hazardous waste, the infectious waste have to be segregated right at the generation point and stored, handled, then transported and disposed of in a separate sequence as compared to the general waste, which has to be stored, transported, and disposed of in a municipal facility, mostly in a separate manner. So the general waste and the biomedical waste have to be completely segregated right at the source of the generation of the hazardous waste. That is the first thing. And that is why the segregation is very critical. Because if you do the segregation later on, the infectious waste will infect the non-infectious waste. It will make all the waste infectious. I will just say that. Because as you can see, the hazardous wastes are very small in volume. Say these are 15 to 25% of the total waste is a hazardous waste in any healthcare facility. Rest of 75 to 80% of the waste is a general waste. So if that 15 to 25% waste, hazardous waste, mixes with the general waste, the entire 100% waste will become infectious. So it will have very adverse implications on the transportation, storage, as well as the final treatment options. So that is why you have to understand that the segregation is a critical step and it has to be ensured at all costs in all the healthcare facility. And effective segregation in the healthcare facility, it requires repeated health awareness creation among all category of health workers. It requires, say, similar messages on a repeated basis to be given to the person so that it becomes a intuitive response on part of the persons who are handling the waste, as well as who are generating the waste in the healthcare facility. Plus, it also requires availability and usage of appropriate biomedical waste handling tools. For example, the waste containers of the right type and the color, the trolleys also for provision of the waste collection at or near the waste generation. For example, some good practices in the hospitals, they now have the trolleys, the nursing trolleys, which have got a receptacle for waste collection right over there. So that when the nurse is giving the injection, the waste is put directly over there in the containers, as well as the swabs and bandages are also just put into the waste container and the bag right at or near the source of generation. So the trolleys are now manufactured with the same design in many of the health system projects also. So the tools also have to be there. In addition to these waste collection tools, you have to have the sharps destruction tools for the mutilation and cutting of the needles, as well as the needle cutters. Those are also required. The personal protective equipments, these are also required. So these have to be there at that point. And also a system of continuous surveillance and monitoring of the activities. We just can't give education to the workers and give them the tools and then sit back and think that the waste would be collected in a right manner and disposed of in a right manner. No, we have to be constant monitor the waste collection activities, identify what are the gaps and correct those, as I'll be talking in the training also now. So it requires many actions on the part of the health facilities. Firstly, the awareness repeatedly and tools, as well as the system of monitoring and surveillance. So once these are there, then we can ensure that the segregation will go further. Okay, next slide. Next slide, can I have? See, once we have segregated, there are certain types of waste which require mutilation. Mutilation means destruction of their forms and structure. For example, the syringes, needles, IV bottles, tubings, etc. They have a potential for the misuse by certain groups who and these then pose a high risk of infection among the communities. You all must have seen the common scenarios in the various dump sites where the various children and the various scavengers, they sort the waste and they put the things into the bags. Many times it contains the syringes, gloves, and other bottles, etc. And these are reused and sold again in the market at a low price to a highly vulnerable population, that is a poor socioeconomic group. So these are repacked and resold, and these pose very high infection risk among the communities. So these are the practices we all have seen in our life, and that is why we have to have a system of mutilation of the biomedical waste. This is carried out simply by cutting of the tubes and the bandages by the use of scissors, use of a needle cutter or needle destroyers, electrically or mechanical types, as well as the prepper shredders, etc. And these tools, they help in the prevention of spread of infection among these communities. So that is why, apart from the segregation, mutilation of the biomedical waste is also very important. Next slide, sir. Next slide. Yeah. So when we are handling this, these are the things we have done with the waste. And then along with that, there is an important area of the infection prevention, that is the hand hygiene. We all have seen. Hand hygiene is one of the key protective measures for the protection against the infections as well as the chemicals. Hand washing is indicated before and after examining a patient, when we are removing the gloves after the clinical procedures, as well as whenever if there is an exposure with the blood or any other body fluid when the gloves are worn. After that, you remove the glove and you have to carry out a hand hygiene. And it is the most effective personal protective measure, I would say. I was in West Africa, in Liberia. I was a WHO coordinator for Ebola response in Liberia for 7 months. And our main protective procedure was the hand hygiene. And we during the COVID-19, we have done it with the plain water and soap as well as the alcohol rub. At that time, we did it with a chlorine solution also. The WHO initially advised, CDC advised the chlorine solution, weak solution for washing of the hand, but it proved very irritant to the skin. So it was not recommended during the COVID-19 to have a chlorine as a disinfectant for the hand washing. But the hand hygiene is the key procedure for your protection while handling any of the waste as well as the clinical procedures. Next slide, please. Then along with the hand hygiene, as you have seen in the COVID-19, we have to carry out disinfection of the wastes. For example, what are the key areas, things that require disinfection? Like I say, the plastic syringe, needles, IV cannula, culture plates, they contain high concentration of the microbes, and hence these have to be disinfected before treatment and disposal. Then liquid waste like the urine, body fluids, these also have to be disinfected in the facility. Then furniture and the equipment use. You have seen even in the home during the COVID, we have done the disinfection of the surfaces very rigorously. So same thing has to be carried out in the healthcare facilities, like the furniture and equipment used in the patient care, like bedpans, bowls, mattresses, thermometers, endotracheal tubes, etc. All these need to be disinfected before their reuse. So disinfection has to be carried out as a routine procedure in a very rigorous manner to prevent the infections. Next slide. So why these are important? Because these form a part of the occupational health and safety. When we talk about the occupational health and safety measures in the healthcare facility, these are critical for the protection of the health workforce. And protection of the health workforce is critical because then only the health system can survive. I have seen during the Ebola crisis in the West Africa, the health workers were affected first and they left the health posts, as a result of which entire health system collapsed and the whole country was in shambles because of the uh, Ebola. So the protection of the healthcare workforce is very critical for protection of the entire community. And that is why occupational health and safety becomes a critical protective system. And under occupational health and safety of the health workforce, there has to be a medical surveillance plan so that we can monitor their health when they are joining, when over a period of time, when they are with the work during their working, as well as whenever they are going to retire. In the same way, we need to have a medical surveillance plan. Then there has to be an adequacy and appropriate of the preventive equipment, like the various PPEs, needle cutters. These are required for their protection. Then there have to be operational control procedures for collection, segregation of the waste, transportation of the waste, how it is to be stored on site, hand washing procedures, equipment hygiene, building and general sanitation, etc. So all these, they require the safe work practices. Safe work practices. And those procedures have to be very clearly defined. That is another thing that has to be there. Then there is a requirement for the immunization of healthcare workers against the tetanus and the hepatitis B. These are the risks to the healthcare workers, because when they are handling other types of uh, equipment like the waste, trolleys, etc., they can get the tetanus also, as well as the hepatitis B. Especially the tetanus is a risk for the healthcare waste handlers. And hepatitis B is a risk to anyone who generates the healthcare waste. So there has to be a system of immunization with the hepatitis B vaccine. That has to be there. Then there has to be a system of monitoring of the accidents. See, sometimes there can be needle stick injuries. These are very common. These are very common among the nursing and the other, especially the nursing staff, the OT staff, the labor room staffs, etc. They are at a very high risk of needle injuries. And these have a potential for causing the hepatitis B, C, and HIV. So that is a big risk. Then the blood exposure can be there, mercury exposure can be there, and other waste spills, various chemicals and other chemicals can be disposed. There can be spills, and those have to be contained. So there has to be a system for the monitoring of these type of accidents. And then on a broader scale, we have to monitor the rate of hospital-acquired infections in different hospitals that can act as a proxy indicator of the effectiveness of the occupational health and safety, as well as a direct indicator of the patient safety and the quality of the healthcare. So these are the aspects under the occupational health and safety that need to be there in place. Next slide, sir. See, now when we are talking about the regulation, there is a regulation now in place. That is the Biomedical Waste Management Rules 2016. And these regulations, they clearly specify the duties of the occupier. Occupier is anyone who generates the waste, handles the waste, and then sends it for final treatment. So the rules, they clearly specify the duties of the occupier, and their duty includes the provision of the safe space for the storage of the segregated biomedical waste. The rules also have talked about phasing out of the chlorinated plastic bags over a period of time, providing training to all the healthcare workers, immunization against hepatitis B, and establishing a barcode system for bags or containers so that these can be tracked. There have been incidents earlier where the biomedical waste were transported from the healthcare facility but never reached the common treatment facility. So these have to be tracked, and that is why there is now a system for the monitoring of that transportation through the barcodes. That is now vigorously uh, ensured, and that helps the Central Pollution Control Board to have an eye on the actual uh, on-time monitoring of the waste from the various sources, and its tracking of its transportation and final treatment also to that. From the generation, transportation, and treatment, at all the stages, it helps the Pollution Control Board to do that. So next slide. Then there are duties of operators. These are related to the facilities which are treating the wastes. They have to report the major accidents and measures to the State Pollution Control Board. They have to ensure timely collection. That is now they have to ensure that within 48 hours, they have to collect the biomedical waste from the healthcare facility. And also the recyclable waste for the treatment for or autoclaving and incineration. And barcoding system, as I said, and assist the healthcare facilities for the training of the workers, as well as they are required to upgrade the existing incinerators for the standards in the secondary chamber. When the rules were initiated in 98, there were certain standards which were established for the incineration. But over a period of time, it said that for the more effective levels of the emissions control from the stacks as well as the scrubbing system, there have to be strict standards of the temperatures and the air entry, etc., for in the both the primary and the secondary chamber in the incinerators. I'm not talking about the technical details in the incineration. That's a very big area. So, but the regulations, they have now specified that there are certain conditions which have to be ensured by these treatment facilities. So you see that the regulation has now become more strict and but very straightforward. Next slide. So and there are other requirements in the biomedical rules that now it has been established that every common biomedical treatment facility will cater to a radius of 75 kilometers around that facility, and that has to be maintained. And the biomedical waste categories have been simplified. Earlier, there used to be 9 or 10 categories based on the WHO classifications. But now these have been simplified into 4 categories of the biomedical waste, which are in the Schedule 1 of the rules that specify what type of waste will go into each and how this will be sent for the treatment. Like these are the categories: the yellow waste, yellow bins, red bins, white and blue bins. And as I said, the no untreated biomedical waste can be kept beyond 48 hours. If it is kept beyond 48 hours, there have to be the informing to the State Pollution Control Board with the reason for that. Next slide, sir. And then earlier there, in the earlier rules, in 1998 rules, there was authorization process was complicated. So now it has been simplified. If you for all the non-bedded healthcare facilities like the clinics, etc., laboratories, etc., they can have a one-time authorization only. And most of the other facilities, usually the authorization is given beyond 3 years, that is up to 5 years. And it has they also have to have other consents like the air consent as the water consent, though those are also taken into account so that the facilities they get it in a much faster manner and in a much simplified way. And then they have to have a implementation monitoring that is very strict now. They have to have provide an annual report. Every facility has to submit an annual report in the prescribed format by 30th June. And then this report will go to the Central Pollution Control Board from the State Pollution Control Board. And then this CPCB will submit a report to the Ministry of Environment and Forest. So there is a whole chain of the monitoring now, and it is the time bound. And these annual reports are now available on the website of the occupier. So there is a much more transparency in that case. Earlier, there was transparency was lacking when we started out in the healthcare systems in early 2000s and mid 2000 up to the end of 2011, 12, 13, 14. Before this 2016 rules came out, the transparency was lacking in many cases, like the transportation of the waste, treatment, the method of treatment. So now these are getting more synchronized and simplified and streamlined also. Next slide. And then there are various types of records and reporting, which are to be kept for the generation, collection, treatment, and disposal. And these are records are kept on the Biomedical Waste Management website. And then any major accident which happens has to be intimated immediately to the State Pollution Control Board. For example, if a vehicle overturns, there's a spillage of the waste on the community areas, then that has to be informed to the State Pollution Control Board or Pollution Control Committee within 24 hours so that action can be taken and community health and risk can be protected. Next slide. So what are these major and minor accidents? I'm just telling you because as an occupier, you might be interested. Major accidents include example like the toppling of the vehicle carrying the biomedical waste, accidental release of biomedical waste in a water body, fires, blasts in the facility or the treatment area, then flooding or erosion of the deep burial pits. Many times the deep burial pits are just constructed in the healthcare facility in the remote areas, and these are prone for the flooding. If these get flooded, then the water bodies can get contaminated. So it has got a high risk of transmission of the infections. So that also has to be considered as a major accident, and that has to be reported to the Pollution Control Board within 24 hours. However, there are minor incidents like the needle stick injuries, blood body fluid splashes, mercury spill, chemical spills, as I talked. These are happening off and on within the healthcare facility. These have to be managed within the facility, and these have to be tracked and monitored. But these are reported in the annual report, not immediately to the healthcare or the State Pollution Control Board. So these are the things that need to be taken care of when you are involved in the healthcare waste. Next slide. Next slide, sir. See, as I said, the barcode system is a new system that has been now introduced, a very effective one. Incinerators improvements in the standards for the retention time. That is another thing. Waste category simplification and the authorization process simplification. These are the key changes in the current rules over the previous rules. And these are important to know because these are very helpful for implementation. And now I would say that as a owner of the healthcare facility within the organization, for example, in the industrial organization, you will have an occupational health center or a medical center. So as a key responsible person, it becomes now easier to handle all the biomedical waste in a systematic manner. Just follow the rules, just have the guidelines and implement it. It does not require much of creativity on your part. It just requires compliance on your part, I would say. Okay. Next slide, sir. And now the earlier the rules were covering the healthcare facilities only, but now the camps and the community health activities like the vaccination, blood donation, surgeries, school health services, industrial health posts are also now covered under the biomedical waste clearly. And there have been phased out targets for the chlorinated plastics like the gloves, blood bags, and waste bags. Like within the two years from the publication of these 2016 rules, these were to be phased out, but still these are now being phased out in a gradual manner from healthcare facility. And also the highly infectious wastes are to be disinfected before handling for the final treatment to the common facility as per the biomedical waste rules guidelines. There are clear guidelines for the liquid waste uh, disinfection as well as the highly infectious waste disinfection now within the rules. So these are much simply but the more effective guidelines provided in the rules. Now, next slide. And in the new rules, the land also, this was a common problem. The land for the common treatment facilities was not available, or wherever it was available, there used to be some community concerns because of the bad smell or the site. But now it is a responsibility of the state government clearly to provide the land. The municipal bodies, they are entrusted with the responsibility to make available the land available for the treatment. And on-site treatment and disposal by the healthcare facilities are now discouraged by the pollution control boards. They now encourage that all the facilities within the 75 kilometers of the uh, common treatment facility, they get the services of the common treatment facility. Because individual facilities, the incineration becomes not cost effective, but also very hazardous for the nearby communities. If there is a much high emission of the air pollutants as well as the water pollutants also. So that is why these are discouraged. And the common treatment facilities are encouraged, as well as the regular training provisions to all the persons handling the biomedical waste and immunization of the health workers against the tetanus as well as the hepatitis B has to be provided by the healthcare facilities as an occupational health care provision. So these are certain new improvements in the rules. Next slide. And these are, I will not go into the thing. There are various schedules they specify. Like the schedule 1 is very important. It specifies the biomedical waste categories, how these are to be segregated, the collection, treatment and processing and disposal options. It clearly specifies all these. Then schedule 2 contains various types of standards for the incinerators, emissions, and other different types of technologies which are involved, and it includes those standards for that. Next slide. And then there is a schedule for the autoclaving. And so you can see there are various technologies. I'm not entering into all the details of the technologies like autoclaving, microwaving, or if there's nothing else, then deep burial, chemical disinfection, dry heat sterilization. but these are to be carried out at the level of the common treatment facility. So we are not much concerned. But the standards for the liquid waste disinfection are important for us. And then there is a Schedule 3, which provides a list of prescribed authorities and their corresponding duties. This is another important improvement in the current rules, that the various authorities, their clear listing is provided, as well as their roles and responsibilities are provided in. And then Schedule 4 provides the labels on the containers and bags, and Schedule 4B provides a label for transporting the biomedical waste containers or the bags. So next slide. And then there are various types of forms for the reporting and other thing. For form 1 is accident reporting. As I said, all accidents have to be reported. Then there is a specific form for the application for the authorization or the renewal of authorization. See, authorization of the healthcare facility is very much lacking. Surprisingly, you might be thinking that the healthcare facilities, they do get the authorization from the Pollution Control Board, but from my experience, I've seen that the very low percentage of the healthcare facilities are identified and have the authorization. So once they don't have the authorization, these are not included in the as an identity. So we don't have that correct uh, amount of waste that is generated. We can only hypothecate about the number of facilities and their size. So that is why the authorization is very much required and it has to be taken. Then there is a form for the authorization from the uh, Pollution Control Board, which specify what are the conditions the healthcare facility has to follow. And then there is a format for the annual report and also a format application for the appeal against any order passed by the prescribed authority. So there are different types of forms and formats for the reporting and the monitoring. Next slide. So as I said, the training and awareness is very much important. And for the training and awareness, there has to be training and awareness at for all the stakeholders, like the occupier who generate occupier is the healthcare facility. Then there is the operator who is the common treatment facility. Then there is a Ministry of Health and Family Welfare, which has to be made aware of the importance of this. And then Central Pollution Control Board, that is also a stakeholder as a responsible agency. Then state or UT government is responsible as a generator. Then State Pollution Control Board and committees are responsible for the directly implementing the regulation in their own areas. So there are various responsibilities specified on their way, and they all are responsible for improving the training and capacity building within their own organizations as well as other organizations. Next slide. And when we are going for the healthcare awareness in the healthcare facility on the biomedical waste, see, awareness has to be there for everyone who is working in the healthcare facility, right from the top to the bottom, and even to the community and the patients and the relatives who are visiting over there. For all of them, there has to be a training, that awareness creation, either through the training or through the IEC, information, education, and communication measures. So that is there. So as I say, the administrator, the medical officer, nursing and technicians, healthcare workers, and the sanitation workers, these are all the key categories. They have to be made aware of the healthcare facilities. Next slide. And when we are going for the training methods, one is the usual audiovisual presentation. That is one method. But for the healthcare workers at the facility level, demonstration and on-the-job training, that is very important. There has to be practical demonstration and on-job training for the segregation of the healthcare waste, how to segregate the waste into the different containers, how to use the needle cutter, how to use the needle cutter and handle the waste, what are the safe work practices for the shops, methods of the high-end and high environmental hygiene, What are the spill containment procedures, like how to handle, what is the protocol for the management of the blood spill, what is the protocol for the management of the mercury spill, what are the precautions. So all these have to be better used through the demonstration methods as well as the on-job training. Next slide. And once we have provided the training, we have to have a system of follow-up, which is very much important, as I said. We have to keep on observing the skill in the service delivery, how they are doing the work after the training. We have to have a feedback through the simple structured questionnaire from the persons who have received the training. And we have to provide the supportive supervision if there is any gap in the skills or the knowledge. And we have to identify persons for the retraining and replan the training and go for it. So this is a complete process. This has to be done on a continuous basis. So once we ensure these actions on our part, we can be sure that we will be able to handle the healthcare waste in a safe and effective manner. Next slide, sir. So here are certain resources which I have put for your own usage. You can just copy these, and these would be, I think these would be provided to you. And I would say these are the basic resources, like it's a safe management of the waste from the healthcare facility. There's a very important book by the WHO. That is the Bible, I would say, of the healthcare waste management. Then there is another good book on the quality of care by improving the wash and waste management, focused on the wash facilities and the waste management in the health sector. And then the biomedical waste management rule. I would suggest everyone to have a copy of the rules and go through those rules and have these at the workplaces so that anyone can go through it. And these are very simple and very prescriptive, and now very easy to implement. And then there is a very useful toolkit on biomedical waste management rules by the CPCP and National Productivity Council. I found it very useful. So that link is also there now. So you can have a look at that. That's a very useful book. I would suggest everyone to go for it. So these are certain resources that I have encircled in there. So, and the next slide, sir. So what I would end my presentation in that I would end it with the words of the Florence Nightingale, the famous nurse who was the most powerful in the nursing profession, and who very rightly said that the very first requirement in a hospital is that it should do the sick no harm. So that should be our aim, and by handling the healthcare waste in a safe and effective manner, we can not only protect the health and safety of the workers, we can improve the patient safety, we can improve the hospital output, and we can we can safeguard the health of the community as a whole, and also the environment as a whole. Thank you.
Thank you very much, Dr. Mudgal, for a very wonderful and very valuable, academically rich presentation, I think, and I'm sure all the participants who are participating in this webinar would be immensely benefited. So I think there are some couple of hands up for some questions. Can you kindly put your video on? I'm not able to see
Okay.
you.
Yes, sure. Yeah.
So that, yeah. Thank you. So there are a couple of hands are there. I think I'll ask my colleague Vinod to start, and then there are other also to. Yeah, please go ahead, Vinod. Yeah.
First of all, I convey my sincere thanks to Dr. Mudgal first, and Dr. Sen for arranging this valuable session because we are into safety fraternity, and we have been continuously focusing on safety at workplace, how we can improve safety, and we are keep on saying about safety of workplace, but we never thought about means not focused much on the field of health. When you are keeping health with the required level of parameters as well as the fitness being maintained or equipment, which also contributes towards your safety at workplace. So you have been nicely explained with various experiences you had in public health also. So my question would be, we are into construction industry majorly, and if we would be more helpful if you can guide maybe one or two kind of instructions how we can take this biomedical waste management forward so in our kind of construction industry. So that would be helpful for many of our participants.
See, in the construction sector, I would say your construction and demolition waste is a key waste that is generated over there. Am I right?
Yeah.
And then biomedical waste as such would be generated in a very minuscule amount, say, especially in the health post.
Yes.
Wherever those are there in your construction or in your campsite also, or in the health clinic over there. And maybe you can tie up with a local medical facility or the local this one common treatment facility for transportation. Better would be to tie up with a local facility for that, but because it would be in a very minuscule amount.
Yes. Volume would be not that kind.
Yeah.
of.
That
one more
would be I
question.
would suggest, because
Yes, sir. Thank you.
you can't go for the authorization from the uh, pollution control board on that basis, because your mostly work is a temporary, time
Yes.
bound in that area setting. So I would say that in that case you can. And
Yes,
but
sir.
all the other provisions, as I talked about in the thing, you can implement those, the occupational health and safety measures, the if within the health facility they are handling the injections, you can have a needle cutters, personal protective equipment, surface hygiene, all those procedures you have to implement.
Yes, thank you. So one more
Is it
question.
okay?
Actually,
Yeah.
we have been facing at couple of our project sites. As you rightly said, it is construction is a temporary business, and we used to stay for a particular location for a certain period of time. So we have been engaging a couple of contract workers, and we have faced in the past that a couple of our workers who are doing good at workplace, and suddenly they are getting some kind of health issues at when they are into the workman habitat majorly. So and when they are declaring their self declaration on health parameters, everything they are saying yes sir, we don't have any such history of health issues. And by that declaration, and after taking the key vital parameters checked and verified by the doctor, then only they are being employed. But after maybe 1 month or 2 months time, we are getting certain issues with respect to the health, which was only known to the person who is actually declaring that this is there is no such health issues. So
Yeah.
if you can give us some idea, so instead of asking them self declare yourself about your health histogram or history, so is there any other way where we can identify, or through your, because you may be visiting couple of countries, you may be attending couple of sessions in various programs, so you might have heard about some other mechanism which we can also use in our
Yes.
business.
Yes, this is a very difficult question, and there are no straightaway answer, but there are ways in which you can have a better baseline about the person when he or she is joining. If you have a pre-employment uh, questionnaire and the format, you can record the say height, weight, body mass index, blood pressure, and as well as the lung function testing and the hearing testing. Many a time, if the person, for example, I'm just saying, if the person has worked in a crusher, unorganized sector,
Yeah.
and that person has developed the respiratory exposure, very high respiratory exposure, as well as the hearing also.
Hearing loss.
So when the person joins, within that time, if you have only a questionnaire, no objective examination, then you will be in a, I would say, poorer position to later on say that this happened because of working for this 6 months only here. It was there earlier also. It could be there. So I would say that to have a good baseline, if you have a wider battery of tests, that will help you in putting in a much better position. Because although the medical, that conformity cannot be there with 100% positivity, that correlation, isn't it?
Yes. Right. Thank
I
you, sir.
think that is one way. In that, then there
Thanks
are
for
certain structured questionnaires also provided by the, I think IOH also had long back, there was a pre-employment questionnaire. There are pre-employment questionnaire about the mental health also. There is about the general health, various things. You can uh, get that also and adapt it to your use.
Thank you, sir.
There
Thank
are
you.
Thank you.
certain
Thank you.
tools available over there. Okay.
Thank you. Dr. Miguel, I think very good question, but you also very nicely answered. But I heard 2-3 years back that there's a national database going to be created by the current government. That I mean, is that in progress? You have any idea? Like all our data, medical data, will be online and like Aadhaar card. If I go from one city to another city, I need not carry my medical report. I can just the doctor can access everything online. Is that something going on in that?
No, I'm not aware of now, but I will inquire if from
Okay.
you have
Okay, sir.
raised it a nice point. I'll inquire it from
Because
the sources. I'm not
Thank
aware
you.
of. Even in the
Okay.
Ayushman Bharat scheme also, I didn't see any such type of affair. But although there are other parameters that the government is including, like the
Because it
wider
will be very
coverage
nice
of
for
the
the
disease.
epidemiological study, because you see, I mean, and all the data will be okay. It will be private data, but then can be accessed with the permission of the
With the permission, yes, obviously,
patient,
that
and that
has to
can
be
be
there.
enabled with the Aadhaar or some other digital card which government is now giving. No, another card they are giving. So
Yes,
National
yes.
Health Mission. So that I think in that case, I mean, going from one city to other, one report you are missing, or all the history will be there with the persons how the BP had been. We also don't remember 6 years before what was the BP and how that it is,
Yes.
because it is very difficult
No,
to
no.
physically have the data, in fact. So once it is measured, if it is online, then
Absolutely,
the
I would say
patient himself will can see that how the graph is going
the
over a period of time.
trend
I think
analysis would be
yeah,
easier, no?
yeah, yeah,
That
exactly.
is what.
Yeah,
Because what, so you have asked, it's basically if we have the previous data, we can get the trend.
yeah, exactly.
If we don't have the baseline, then it becomes he or she can say that I was exposed here only, and
Yeah,
within that
exactly.
few months only I have developed this.
Yeah, possible.
Wherever you as a employer would not be able to prove that.
Exactly.
That is the
Exactly.
thing.
Yeah. So another, I think there is another, I mean, a few more hands, but I think in the interest of time, maybe Upashana, you have something to ask?
Yes, sir. Good evening, sir. First of all, thank you for your insightful and informative session. We learned a lot from this. I have one question, not exactly from the waste management or bio waste management. As we all are going to hospitals and as a general public, we are facing like someone is spitting on road and we are walking, so there are chances of getting contaminated with that. So is there any kind of like basic vaccinations other than tetanus and hepatitis that we have to take to get like to have prevention or immunization from these kind of things?
Well, madam, I would say, as I said, the hand hygiene their daily body wash, taking bath every day, and keeping the hands clean, keeping the clothes clean. The general hygiene we should not forget. And washing our hands before eating food, washing our hands after the defecation and urination, and also just after anything, if we have come into contact with anything suspicious, then that is the most effective way. I would say that hand washing for at least 30 seconds, both the front and the back of the hands. Like there used to be a method of the hand washing. I have not demonstrated, because we can demonstrate it when we are doing the hand on-site training. But hand hygiene is very important, and it has to be at least for 35 seconds, and both front and back, and the fingers, the knuckles, and the in between the grooves, all these should be rubbed carefully. We just wash our hands in a very cursory manner, and then we hope that it will protect us. No, it is not. As I was saying that when I was in Liberia during Ebola, Ebola was transmitted through blood and body fluid, very highly risky and very high case fatality rate. So we had to be very careful, and hand hygiene was the key factor for our protection. So I would suggest there is no specific immunization, no, because you are at a risk of n number of infections. If somebody is spitting or something, there can be hundreds of infections which can be there. So
Okay.
there cannot be one this vaccine for that, but only the protection would be your personal sanitation, your hygiene habits, your food hygiene, your personal hygiene, and your environmental sanitation. These are the factors that will protect you. Because long back there was a study where they found that in Kerala, in spite of a low income, per capita income, the infection rate was very low. And it was later on explained that the old habit of washing our hands before eating food and after the defecation in a very regular manner, that was the main factor. And that was a factor that led to the development of hand hygiene and sanitation procedures at the levels of WHO and other facilities in 80s and 90s. So I would suggest hand hygiene, your personal hygiene, your family, community hygiene, and environmental hygiene. These are the issues that you have to take care. That will protect you.
Okay, sir. Thank you, sir.
Welcome.
Thank you. I think Mr. Opu Chandra Saha has a question. So he has raised his hand. Please go ahead. Yeah. This is the last
Good evening,
one.
sir.
Good evening.
Good evening, sir. First of all, thankful to the platform to give an opportunity to hear and to get a lot of learn regarding waste management, biomedical waste management. Actually, we have faced a challenge during 2019. At the time, we went to the hospital for our daughter's treatment. And our platelet got in 7,000 platelet was, and all the particles was very low. And during that time, my question that how can we protect our children while the platelet is very low, immunity power is very low, and there is so much environmental and health risk in the hospital. And second is there are some what is that dressing? We have to do some dressing in chemo line in our room regarding the treatment. How can we protect the children while we dressing the chemo line, because it is a very sensitive line. Chemo line is very sensitive line, and while we are dressing our children's chemo line, what precautions should we take?
See, I would suggest you ask the specific person who has prescribed you that type of treatment, because specific related to the stimuli, I would not be able to answer your question because these are very highly procedure specific.
Okay, sir.
Okay. But for the children and all, I would say that in any healthcare facility, children and the high risk person should not visit the case as a visitor. Only go if you suffer something, but not as a visitor, I would say. But the stimuli, I will not be able to say because this is highly procedure specific. I'm not used.
Okay, because this is, I think, very specific. So chemical and other
Yeah.
things,
Yeah.
without because it may vary from, I think, treatment to treatment and
Treatment
so
to treatment. That was
and also
that's
So, but he has a very important query. I think that particular center may be able to give you the best
yes.
answer.
I would suggest that only because
Instead of thank you very much. Actually, and I think there are a lot of good feedback, as you have seen. Those who have spoken have shared. I personally felt that is a very wonderful session by you, and we all are very grateful from the ASSP India chapter as well as the L&T colleagues who are participating in this meeting. And it is very, you can say, nice that you kindly agreed in a very short notice, though you have very tight schedule. But then, thank you very much. And I think in future we will give you some more time for some specific topic where in the people who are who are associated with construction. Many people are participating who are basically from
construction. And I would like to share with you that for L&T, this Panipat flyover, I worked as a consultant. I introduced it was a one-day safety supervisors training. I introduced the occupational health and safety and the environmental content into that in 2006-07.
I used to go that time to Panipat. I had a colleague there working, Rakesh Umar. I don't know whether
Mr. Tripathi was there, if I am not wrong.
A.K. Tripathi. He was in Delhi.
A.K. Tripathi was there.
Excellent.
So I used to go there. Even so, that was a nice experience working in the construction sites. And
No, so I remember that flyover because when the flyover was under construction, I used to go to Panipat because I was I used to go in 2007 onwards. So that time also it was going on.
Yes,
2007 end 2000.
That was the time when we introduced that occupational health element in that safety training. I added into that, and then it was further elaborated later.
Okay. And it's very important because you see the many hazards which are not recognized or the engineers do not know. So we have a big role to create that awareness at site that the people are getting exposed to dust, and the postural problem as well as vibration, noise. Absolutely. I mean, so many things. And most of these do not give any acute adverse outcome, but over a long period, they just kill them. And unfortunately, when they get the disease, they may not be with us. And then we will not be able to do anything. So it is very important that we, as a responsible company and as a good human, we try to protect the person and not harm him and leave it back to his family and society.
Yes, absolutely.
So if somebody is coming, a young man with his good body to work with us, it is our responsibility that we don't harm him. We protect his health, and we give the society back that same resource with his capacity and the fitness he came to us. So I think that is a thing we all need to remember on this very important National Safety Day, that we are getting resources from the society, and that is human resources that, and then we should not harm it and give some money up as a daily wages and throw him back to the society where himself, his family member, his relative, and his community will suffer. So I think we have a very big responsibility as professionals and human beings to take care of our workers so that they go unharmed, not only from accident, but also ill health and environmental things. So with this, thank you, sir, once again, and from all our behalf.
Thanks to everyone. It was really nice to interact with you. Maybe
Thank you.
we can interact on other topics also.
Yeah, sure, sure. We
Yeah.
will organize a preliminary approach. Thank you very much.
Thank
Sir.
you.
Thank you. Thank you.
Thank
Thank
you.
you. So we close this meeting. Thank you. Thank you.
Sure.
All. Thank you all
Thank you.
participants.
Bye-bye.
Everybody. Yeah. Thank you.